Unayotazama ni Runinga Magharibi na hizi ni habari za Magharibi jioni. Moja kwa moja katika makala yetu ya afya hii leo, ambapo kwenye makala yetu wiki hii tunaangazia sehemu ya pili ya ugonjwa wa lupus tukiwa naye daktari Dickens Lubanga. Kwa mengi zaidi tupate makala hayo.
And like we're saying, basically SLE affects all the system because like you're saying that the body does not recognize its own tissues, therefore it fights the entire cells actually in the body, and so you're going to have symptoms almost in every organ of the body. So, but the ones I'm mentioning are the ones which are more common. So, some of them will have arthritis. Arthritis just means their joints, joint involvement. So, either you'll see some of them who are unable to move their joints, they've got painful joints, and also some of them will have joint deformities, whereby some of the bones assume different shapes because of this autoimmune condition that is done by SLE. Some of them will affect their blood levels. That is, we call it hematological phenomenon, whereby they might tend to have low blood levels or anemia, and also they might also have other low blood levels like the white blood cell count and also the platelet count, which might necessitate actually for transfusion whenever they're admitted actually in the hospitals. So basically it affects almost all the body organs. Some of the patients will actually have renal involvement, that is the kidneys might present with one or two signs, including kidney failure, and so they might even have complications and actually lead to dialysis. So when I talk about the heart, also SLE can still affect the heart. It can cause cardiomyopathies and also cause heart failure. So remember, the heart is quite important, and when the cells actually start attacking themselves, then we start having issues because now they're not able to contract enough for your heart to be able to pump blood. And so when this is involved, then you tend to have those effects. So it will still affect even the eyes. SLE will affect basically the whole body system, and this one comes in based on the duration of how long you've had the symptoms, and it actually kills because it means that you have to be on treatment that avoids your body against reacting against its own tissues. So at this level, so we'll go to the treatment options. So like you're saying that majority of it, since it affects the entire body, basically it will have a lot of, it will need a lot of people, basically a lot of factors in terms of its management. But the basic doctor who is able to treat this SLE will actually be a physician. And so so most of the time we tend to use drugs that tend to hide the immune system. So basically they lower the threshold of the immunity so that their cells do not fight their own cells. So most of the time we put them on steroids. Steroids are actually drugs that help to lower the body's immunity. And remember, we are doing this so that they don't recognize their own body cells as foreign, so that they don't continuously keep fighting their own body cells. Also, apart from steroids that you use, most of the time we tend to use anti-cancer medications. Remember, anti-cancer medications also, the drugs, they're embraced because they avoid multiplication of cells, excessive multiplication of cells. And remember, this is the main factor that helps to aid SLE. Then you are talking about now exposure to the sun. Basically, by the time you are finding out that you have SLE, The first thing that you do also is to encourage you to use sunscreen. And usually we use those stronger sunscreens, at least with 90, potentially to block at least 90 of the UV light spectrum. And this helps also to avoid the discomfort that comes with the skin itchiness and also painful skin. Then the most important is at times we have to engage other people in terms of occupational therapy, because now you might actually, it can disfigure your limbs or even your arms. So we engage other people to help you do a bit of exercise so that you can still live a slightly better quality of life. And then also we use a bit of painkiller because the condition is quite painful. It's quite painful. Like you're saying, you see, we tend to use a lot of drugs because the symptoms are quite non-specific. But remember again, since it's a continuous process, this is a process that continues unless you hide the body's immunity, so that it's not able to recognize its own cells as wrong cells. And instead, so that instead of fighting it, they don't fight the cells. Thank you.
Doc, maybe umesema
disease from one person to another. You cannot get SLE by just associating with people. That's why it's a very rare disease. It's not a common disease. Like you're saying, it's just a group of diseases whereby the immune system misbehaves because it's supposed to know its own cells. But now in this context, it forgets its own cells and starts fighting its own cells. So that's how you gain SLE. So you cannot get it from one person to another because it is an individualized disease by your own body cells. But environmental factors which I've mentioned can cause you to be more susceptible to getting SLE. But genetic predisposition is the most accounting for most of these problems.
And maybe
you've not come across a lot of those studies that show the role of diet, because usually it's something that is within the cells. And so usually we just advise you to take a normal balanced diet, which everyone else is advised to take. Because here the main issue is your immunity. Your immunity is hyperactive. It's reacting to cells that is not supposed to react to. So a treatment that will actually suffice in this case is that ideally suppressing the immunity to avoid it recognizing its own cells as bad.